Okay. So, you know, long back when America was under construction, there were, a lot of fights in the beginning, like, any other country who, kings and different people fight for the lands. And this is how they created, uh, so many states united to become the United States of America. Okay. And when during that process they brought in people from different countries as slaves, especially from the African countries. And give me 1 second, I have to mute this thing is so disturbing. When I'm trying to speak, this thing always keeps on ting 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 ting. This is mute. Okay. All right. So people were, these people were brought in from African countries as slaves to do the hard labor, right? Construction of the railways, construction of, these buildings and a lot of other things, right? These people were brought in as the slaves. Then, the government changed. These people fought back for their rights because, their children were born on this land, right? And then, as per the government, they were supposed to give them the citizenship and all the rights, to their children and grandchildren. They became the citizens of United States, right? So, elsewhere we go in the world, you see people, fighting each other. People in Texas, they don't like people in Michigan. They think they are aliens, right? People from Michigan, they don't like people from Texas, right? It's just not in America, it's across the world. People here in India, from the topmost part of the country, they don't like people from the, bottom part of the country. You know, it's just that language barrier, the way of living. Everybody thinks they're superior to each other. Everybody fights, and they fight for, the religion and the differences in the communities, a lot of things, a lot of other things. In America, there is a big issue, and this is being going on since America was built and these people were brought in as slaves, and that thing is called discrimination. Okay. When you are getting into the nursing side of the business, okay, most of the people who are working at the bottom of the ladder, people who are CNAs and people who are, LPNs, and some, some people, some nurses as well. Okay. You will find them, these are the people from the other origin and different countries. And so in US, there is a fight going on in between the black and white, that Cold War. People fight, the other part of the, world, people fight on the religion. In America, people fight on, the black and white. Okay. So the government of United States, formed an act which was the discrimination law. Okay. So it applies everywhere. But as the employers, we are going to, employ these people. So we cannot discriminate in between those protected characteristics by this law, right? We cannot discriminate because this person uh, is from, some country, some sort of, special race. So there are several protected characteristics that you have to remember, that you cannot, write or say any of these words on phone or on emails. Okay. So, I'll let you watch a video, but before that, I'm going to walk you through those characteristics. And because we are the employers, if somebody, is calling me for a job and, uh, uh, for instance, I I post a job and I write on an email that I'm looking for a secretary, in my office. I just wrote secretary. Secretary doesn't have a gender to it, right? Who is adding the gender? I am adding the gender. That is discrimination. If I'm saying I need a secretary, a female secretary, and who is white in color, that is discrimination, right? So this was just an example. So we as employers, we cannot discriminate in between, these protected characteristics. I mean, we should never do that as humans too, right? The law came later, but as humans also, we should not discriminate, right? So I'm going to show you something here. This is the law. And remember, guys, if you even by mistake you say any of these words or try to put something in writing, that can sue the company so badly. So I'm going to show you something here that I will share with you. Are you guys able to see my screen here?
Yes, sir.
Yes, sir.
The law enforced by EEOC, Equal Employment Opportunity Commission, makes it unlawful for employers like us, employers, to discriminate against employee and job applicant on the basis of race, religion, color, skin complexion, national origin, ancestry, physical disability, mental disability, medical condition, genetic information, marital status, sex, gender, gender identity, gender expression, age, sexual orientation, military status, and veteran status, right? So I want all of you to watch this video for me. There is a lawyer, okay, who's trying to this video is actually made by a lawyer for the employees, that how they can sue the company like us. Okay, so I'm going to share the link with all of you, but I want you to watch this video and please make sure that you take this very seriously. And if you don't know the answer and how to react on that situation, please make sure that you walk up to your managers and talk to them, but do not make this mistake of discriminating anybody. You might also get calls from your nurses saying these nurses, these white nurses, are being racist. Okay, they will complain to you because you are their employers. They will call and complain to you, but you don't have to react. Okay, you can just say, yeah, I understand, I know, yeah, I will definitely escalate this, but I think you should, if you want to complain it, then you have to write an email. I cannot just directly go and say that these people are racist. Okay, because you are their employers. They will come and tell you, hey, Nick, for example, hey Nick, I have these white nurses, two white nurses, they are racist. They don't give me much work. They try to keep me aside because I'm black. So you will all often hear these complaints from your nurses, and trust me, this thing is coming up your way. You have to learn to how to handle these situations. Okay, and so let me show you this video. There is a lawyer, he is in California, and he has made this YouTube video to guide these nurses or any employer and any employees who can sue the companies like us if we discriminate. Okay, watch this video.
Highest paid
Are you guys
entry level job in the world is not of.
You guys able to hear this, right?
Yes,
Somebody
sir.
say
Yes, sir. Yes, sir.
All right. Okay.
Sir.
Product manager or software developer.
My name is Brannigan Robertson, and I'm an employment lawyer. This video is the ultimate guide to workplace discrimination. I'm about to explain discrimination law without all the legal nonsense. So if you want to know if you have a case for discrimination and what it might be worth, then keep watching. Before we go back to the whiteboard, I have 3 quick pieces of business. First, this video will cover the following topics: the legal definition of discrimination, the protected categories, examples of discrimination cases, the EEOC, DFEH, and right to sue letters, the statute of limitations, which is the deadline in which to file your case, how much discrimination cases might be worth, and what to do if you quit, got fired, or if you're still employed. Second, in this video I primarily discussed California law because that is where I have a license to practice law. However, this video is meant for everyone across America. If you are not in California, this video will help you identify critical questions that you should ask a lawyer in your state. If you are in California and you need a consultation, here's my contact information if you think I've earned that phone call. And third, I'm making this video for my ultimate guide to discrimination law page on my website. That webpage dives far deeper into California discrimination law than I can cover in this short video. My website is the best online source for information about discrimination law in California. All right, let's get to the good stuff. Let's first cover the legal definition of discrimination. In California, the main anti-discrimination law is Government Code Section 12940. If you're not in California, Title VII is the federal anti-discrimination law, which protects everybody in America. But your specific state may have an additional anti-discrimination law, and you should look those up. Here is what California's law says. I'm actually going to read the law to you. Section 12940, subsection A says, "It is an unlawful employment practice for an employer because of," that's an important part, "the protected characteristic," which we'll cover in a second, "to refuse to hire or employ the person, or to bar or to discharge the person from employment, or to discriminate against the person in compensation or in terms or privileges of employment." To summarize all that, it is illegal for a company to fire, demote, cut the pay, or refuse to hire anyone because that person has one of these protected characteristics. We'll cover those in just a second. Before we get to them, I need to point out a couple of things. Number one, I only read subsection A of this law. There's a whole lot more to that particular statute and to the entire body of discrimination law. I don't have time to cover all of that in this short video, but if you want to know more about the details of discrimination law, go to my website. Second, this California law only applies to companies that have 5 or more employees. Title VII only applies to companies that have 15 or more employees. So if you work for a small company that is below that threshold, you might have to pursue your case under a different law. Okay, so what are the protected classes or categories in California? Great question. I'm going to read them to you. Race, religion, color, national origin, ancestry, physical disability, mental disability, medical condition, genetic information, marital status, sex, which also includes pregnancy and related medical conditions, gender, gender identity, gender expression, age, if you're over the age of 40, sexual orientation, military, and veteran status. This means that if your employer is doing something bad to you because of one of these characteristics, you may be facing unlawful discrimination. Now, these are the California protected categories. The federal anti-discrimination Title VII law only protects against race, religion, color, national origin, disability, sex, and age. The Age Discrimination in Employment Act and the ADA, which protects against disability, are separate laws, but it doesn't really matter for purposes of this video. Now, each of these categories has a specific legal definition. So if you want to know if the discrimination that you are facing falls into one of these categories, you actually need to call a lawyer. I've also made some specific discrimination videos on race, disability, pregnancy, gender, age, and I think sexual orientation. So if you want to know more about one of those specific areas specifically, go see both the description below the video because I'll have links to those videos. Before we move on, let me talk you through two quick examples. Number one, let's pretend that you've been working a desk job for several years and you're really good at your job, so you've gotten positive reviews. Unfortunately, you are suddenly diagnosed with kidney disease and you have to start dialysis twice a week. You request to arrive at work 10 minutes later than usual on your treatment days so you can finish your full treatment. Now, your boss is a jerk. He's immature. Even though HR tells him to accommodate you, he's upset that you're being given special accommodations. A coworker comes to you and tells you that your boss has privately made comments about how he doesn't want unhealthy people on his team. You try your best, but 3 weeks later, you suddenly get fired for poor job performance. In this situation, you clearly have a physical disability, and if your lawyer can convince 12 people in the jury box that the motivating reason for your termination is your disability, you might prevail in your case. Next, let's pretend that you're 63 years old and you're really good at your job, but you notice that a lot of new faces at your company are really young faces. You actually overhear your new manager talking about her desire to have a young and energetic division. One day at a company party, she actually teases you, "Are you excited about getting your Social Security? I can't wait to throw you a retirement party," even though you have no plans to retire. The next 2 weeks, you start to clash on work assignments, then she writes you up for a negative attitude. After a few more weeks of frustration, she fires you for insubordination and negativity. Once again, if your lawyer can convince a jury that the substantial motivating reason behind your termination is your age, then you'll prevail. Next, if you were paying attention to those examples, you probably noticed that the company never comes out and says, "We're firing you for your disability or your age or your race or your religion or whatever." It's extremely rare in today's world to find direct evidence of discrimination in employment cases. Rather, it's your lawyer's job to prove that the real reason for your termination was one of your protected characteristics. The termination lie that the company will tell you is called pretext, and I've made an entire video on that subject. I highly recommend that you watch that video once you finish this one. I'll put a link at the end of the video. When you hear lawyers like me talking about discrimination law or discrimination cases, you'll often hear us talk about the EEOC or the DFEH. What are these? These are government agencies that try to enforce the workplace anti-discrimination laws. The Equal Employment Opportunity Commission, or EEOC, is the federal agency, so it applies to everyone across the United States, whereas the DFEH, or the Department of Fair Employment and Housing, is the California agency, so it only applies to California employees. For purposes of this video, these agencies do two main things. Number one, they actually pursue cases on behalf of victims, much like a private lawyer like me would do. Secondly, they're a gatekeeper. Before you can pursue your case in court, you need to get a right to sue letter from one of these agencies in order to exhaust your administrative remedies. Now, if you have a good case and you hire a private lawyer like me, I will acquire the right to sue letter for you and we will pursue the case in court. Having a lawyer get your right to sue letter is a smart move. People screw up these right to sue letters all the time. Generally, if you can find a good lawyer to take your case, you should pursue the case with a lawyer. These are government agencies and they are absolutely overwhelmed with claims. Moreover, you rarely hear about the EEOC or the DFEH getting a large settlement or verdict on behalf of an employee. But if you can't find a lawyer to take your case, these agencies are an outstanding option. Next, we have to talk about deadlines. In the law, there are these things called statutes of limitations. This is a hard deadline where you need to file your case by that deadline, and if you don't, you're out of luck. In California, in general, you need to file your claim with the DFEH and get a right to sue letter within 1 year of the last discriminatory act. And then, after you get the right to sue letter, you have 1 year in which to file.
Okay. We don't need to learn how to file the case. Okay. Okay, guys, can I request everybody to turn on their cameras, please? And who is this person with the name of admin? This person was there even yesterday. I could not, this person. Mr. Admin, what is your name?
That is Vinay. That is Vinay. Just a second. Vinay. Just a second.
Ritik. Please keep your cameras on, guys.
To use the restroom real
Done.
quick. I'll be right back.
Done.
Okay.
Done.
This guy admin, can you please, update your screen name here? I call you by your name then. Okay, all right. Okay. Now, did you guys all see how a lawyer can really sue us, if we try to discriminate, So now remember, it is just not for the people who are, employed. It is just the people who are the job applicant. Okay. So these are the nurses who are going to be our, job applicants and our employees. So remember these protected characteristics. Okay, I'm going to share this link of this video here on the chat. Please make sure that you watch it again, because it is very important that you follow this. Okay. All right. Any questions? Any questions on this one? Anything? Maya, why is your camera off?
Hello, yeah, Samir. Actually, HR came for some queries. So
Okay, all right. Okay, so remember these protected characteristics, guys. This is really going to help you to save yourself, okay, and the company. Okay, all right. Okay, so yesterday we started learning about the departments. Okay, so let me ask you a few questions here. Okay, do you remember what we learned yesterday? Richa, do you remember?
Yes, sir.
Yeah, please tell me.
So we learn about the healthcare system and how many levels are there, and IPD, OPD.
Okay, tell me the
And
first
about
three
the-
levels of care.
Sorry, sir.
The first three levels of care.
So first is self-care
Self.
and primary and secondary care.
Okay, primary care, and then
Secondary care.
secondary care, and the fourth care is
So it's
tertiary.
tertiary
Tertiary.
care.
It's called tertiary.
Okay, sir.
Yeah. Okay. Jyotsna, are you on the call?
Yep.
Okay. I'm making you the host here. Can you share that open that document actually? I don't have that document with me. Where do I find you? But okay, here you are. Okay, I have made you the host. Can you start on that part where we left yesterday and ask the questions?
Sure. Samir, there's something I need to attend.
Yeah, can you
I have to take you on that call. It will just take a minute, not more than that.
But do I have to be on that call?
Yeah. It won't take too long.
Okay, guys, just 1 second. Okay, just don't go away. Okay. Okay, now I'm going to ask some questions here. Okay, now okay, so people who fall under up to 4 years of category, what patient population they fall under?
Sir, toddlers.
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 Yeah, they're toddlers. Okay, they are not. Don't call it toddlers.
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 Toddlers. Okay, and the adolescents fall
14 to 18 years.
14 to 18 years. Okay, all right. Okay, now I'm going to just have a go through what we studied yesterday quickly. So self-care and community programs. So these are self-care. It costs the cost is very low, and prevention of healthcare education program, national education, patient self-care community program. So it's just the self-care thing, the primary care, the secondary care, and the tertiary care. So any questions on any of these? Is it clear to everybody?
Yes.
Okay.
Yes, sir.
Okay, so primary care is done, secondary care was done, tertiary care. Yes, please.
I have a question.
Yeah.
Does tertiary care and quaternary care are same?
The tertiary care and what?
Quaternary care.
Tertiary care and the quaternary care. Give me 1 second, okay?
Yes,
Okay,
they're same.
I'll answer that here.
Yes, just now, please.
Yeah.
I need you here. I need your help. I'm stuck.
Okay. So, tertiary and quaternary care, we can say that they go hand to hand, or I would say they are almost similar. Tertiary and quaternary would both have the services where any sort of advanced level treatment, if needed, these facilities are equipped enough to treat those people. So let's say if somebody requires treatment for cancer, somebody requires, let's say, a neurosurgery. So these facilities that provide the tertiary or quaternary level care, they should be able to treat such complex cases. Now, let's say there's a heart transplant case, a kidney transplant case. So if it's a secondary level care facility, they would not be able to provide care to such patients. But yes, if it's a tertiary or a quaternary level care, then yes, these facilities would have the right resources. They'll have all the equipments, they'll have the physicians, they'll have the surgeons, they'll have the entire staff who can provide them with the best level of care. So that's what tertiary and quaternary care is all about.
Okay, does that answer your question?
Yeah, thank you.
Okay, right. Okay, so let's move forward in the training, and just now the link that you sent me here, I messed up with it, but I'm going to.
I can open the document if.
Yes, please open it.
Okay, sure.
Okay, scroll down to the portion where we ended yesterday. I think we did the hospital. What is a hospital?
Yeah.
Okay. And go down, and then we did what, the clinic?
So yeah, starting from the top, we did a little introduction about the healthcare system in United States. And then we did talk about the topics that we'll majorly be covering during the entire training for healthcare. Next, we did talk about different levels where, let me actually, I think the screen size is too big.
No, it is okay.
No.
Now
For
I
me-
cannot see it.
Oh, you can't see it?
No, my eyesight are weak.
Okay, let me try and increase it a little.
A little bit. Yes, that is fine. This is fine. Oh, yeah, this is fine.
How about now?
Yeah, it's fine. Yeah.
Okay, so yeah, this image that you see, it's just an example of a basic case where a person may probably have spinal problems. So let's say if it's at the beginning, if somebody is facing problems with the spine pain or any such similar issues. So at the initial stage, they may want to take care of themselves at home, or maybe they would probably just go for a physical therapy, or they may take some help from the community level programs. But if they are not able to get the right sort of treatment, then they would probably want to consult a physician by going into a primary care, and then they'll take some advice. They'll take uh, suggestions from the physician on how they should proceed ahead. And at the next stage, the same physician or maybe a different physician may suggest them to move on to the secondary care and probably go for further tests. So let's say if it's becoming a chronic issue, then they may probably suggest an MRI just to figure out what is the problem area. Does the patient require a surgery, or can it be treated by some sort of medications? Can it be treated by physical therapy? And if nothing is helping, then they may refer them to the tertiary or quaternary care, where there could be a surgery needed, and post surgery there will be additional treatment plans that have to be provided to the patient. So this was basically that example where same patient may flow down from the self-care and community level stage to the tertiary or quaternary care stage, depending on how severe the situation is. Then we did talk about different age groups or the patient population that you'll see on a day-to-day basis. So when you look at these resumes, when you talk to these people, so you would see these terms. So depending on what job you're recruiting for, let's say you're trying to recruit a nurse who will be specifically working in an ICU. So if they have not mentioned about working with kids, or let's say newly born babies, then we will know that yes, this person is going to be working with adults. So we are supposed to be looking for candidates who do have that sort of experience. So let's say if somebody has been working with newly born babies throughout their life, so they will not be a fit for working within the ICU. And vice versa, if we are trying to hire a person for neonatal care, in that case somebody who has always worked with adults, or let's say elderly patients, even pediatrics, they would not be qualified to work with newly born babies. So it is very important for us to ask such questions on how or what sort of patients have they handled. So the right way to ask is, what kind of patient population have you handled? What age group patients have you worked with? Some of them may have experience working with a wide range of age group people. Let's say people may have experience working with neonatals. They may have some experience working with pediatrics. Some may have had worked with adults as well. So until and unless you don't ask them these questions, you would not know. So we don't have to assume that they must have worked. So if they are telling you that, yeah, they do have that experience, then all the jobs that they have had so far, you are supposed to be asking them that, let's say this was job one. So did you work with pediatrics? Did you work with adults, or was it with neonatals? So after you confirm it with the candidates, you're supposed to be updating the resumes. But there's one thing that you have to make sure: whenever you are updating or making any changes to the resume, make sure you send that version back to the candidate. Let that person review his or her profile, his or her resume, And when they give you a good to go signal, then you can use that resume and share it with the hospital or the clients that we'll be serving. So now let's say if you just update the resume on your own and you do not seek permission to use that new version of the resume. So in future, the candidate may even decline. So let's say there's an interview and the hiring manager tells him that, this is the resume I have in front of me. And the candidate may just say that, this is not my resume. I don't think so. This looks like my resume. So if something like that happens, client can always come back and ask us. I mean, they can probably block us for future. They may not even give us business. So it is very important that we ask right questions. And if we are making any changes, you ask them to review it and get it in written where they say, okay, I approve this resume. Wordings can be different. I'm okay, please go ahead. I approve, I acknowledge, anything is fine. But the main point is that they should acknowledge that they have seen the new version that you're going to present over to the client. Any questions, any doubts on this part?
Okay.
No, ma'am.
Okay. So, again, just a quick recap. Kids who are newly born up to 2 months, they are usually known as neonates or neonatals. Up to 1 year of age would be called as an infant. Up to 4 years, they are usually known as toddlers. Pediatrics or pets up to 14 years. Adolescents up to 18 years. 18 to 60, that will be adult. And elderly people who are above 60 will be known as geriatrics. So, when you will be creating those searches, the experienced people, they already know that, yes, this is how we get the resumes. We have to create search strings, we have to use certain keywords, and that's how we can pull up the right resumes. But we do have a couple of people who are just fresh into this industry, recent college graduates. So this is for you. Whenever we have to find resumes, we have to create right searches. So we have to use Boolean searches, that's what we call it. We have to choose the right keywords, and we have to create a combination of those keywords to find the right resumes. And then when we do that, we have to make sure we also use synonyms, because sometimes people may write pediatric on their resume, they may write children on their resume. So any similar words, we have to, anything that they can think of, we have to put it on our search. So it's more like if a policeman has to catch a thief, they have to think like a thief. So if we have to recruit a candidate, we have to think like a candidate. So we have to think as if I were a candidate, what would I put on my resume? So you have to start thinking like that. So that's the right approach. All right. Okay, so let's move ahead. Somebody wants to say something?
No, thanks.
Okay. So next, we talked about different sort of healthcare facilities that exist.
Excuse me, ma'am.
Hema, yeah. Go ahead.
So what if any hospital are looking for a dual role based on age groups or patient population? Let us say if it is looking for any adults or and also based on different two different position experienced candidate, what would be the case?
So usually the hospitals, they would want to hire for a specialized unit. Okay, so let's say if they want to hire a person for an ICU, so they would want to have a person who has worked with adults. But there could be some situations where they may not have too many patients on the floor. There could be situations when the census is low. So in that case, they may want these nurses or these professionals to work in similar units. So that process is known as floating. So they may ask them to float into different units, but they will be similar in nature. So it's not that a person working in an ICU would be asked to work in a labor and delivery department. So they will be similar in nature. A person working in an ICU, they may ask that person to work in a step down unit because both of them are somewhat similar. But as I said, if the nature of work or the departments are almost opposite, they would not ask them to float into those units. So
Okay.
yes, but we have to inform them beforehand if this job requires them to float. So usually the job descriptions that we receive from the client, it is going to be mentioned clearly whether it requires floating or not. If it does, then we have to make sure the candidates are ready to do that, because a lot of times these nurses that we work with, they are not too keen on floating into different units. So if that's the case, then we are not going to submit them. But yes, if the client needs them to float, then the candidate has to be flexible. They
Okay.
won't have a choice.
Yes. Okay.
Anybody else? Any questions? Any doubts?
No, ma'am.
Okay, so let's move ahead. So as we were discussing yesterday, so all these we have a habit, especially in India. I'll take example for India because majority of people are here. So I'm sure everybody, whenever you require any sort of medical attention or any sort of medical advice, the first thought that comes into our mind is, let's go to a hospital.
Yep.
Right? We never think that, oh, you know what, I don't need to go to a hospital. Just a clinic would help me. I mean, even if I go to a nearby clinic, the doctor should be able to help me with whatever I have going on.
Has anybody in their wildest dream thought of going to an ambulatory care?
Ambulatory care, so yeah, ambulatory
Nobody.
surgical center.
Nobody.
Yeah.
Right?
No.
Nobody.
Sir,
Nobody
we
must have
go
thought.
through incidents.
Yeah, we'll just go to a hospital, right? We'll never think of going to an ambulatory because they do the short term,
Surgeries.
the surgery, right?
Yeah.
We'll always go to a hospital. We'll never think of going to okay, let me do something. I'm going to, go to an urgent care clinic. What is an urgent care clinic? I don't know, right? What we know is a hospital, right?
We just know hospital, yeah. Anybody and everybody wants to go to a hospital if situation like that arises.
No,
So again,
after this training, you would know where to go to.
Yeah. And I think you must have realized, especially after 6 p.m., let's say if we need to go to hospital, so where do we go? No matter what the scenario may be, it could be any sort of
Emergency.
situation, right? So we go to emergency. Suppose there had been an accident on road and people are seriously injured. Where will we take them?
Emergency.
Emergency.
Only.
But in US, we don't take them into emergency, we take them into the trauma care. So now,
Now understand, somebody is lying on the road with their intestine outside their stomach. Are you going to take them to a doctor's office and say, yeah, put them back inside?
put it back and
Right?
yeah.
We
Right.
also have urgent care here too.
Yeah.
Urgent
Yes.
care.
Right.
So we have urgent care here too as well.
Right. So yeah, I mean that is what the difference is. Like, where do we go? Right? Do we go to an ICU directly? Do you go to the doctor? Do you go to an ambulatory care? So
Yeah, somebody cannot just walk down to an ICU. I mean, somebody who's probably conscious, somebody who can walk, that person would not just be willing to go into an ICU directly. That person will have to go into the appropriate unit, and then if the condition is critical, then they'll be going into an ICU. And I'm sure nobody would go on their feet. So somebody has to carry them into an ICU. So all these departments, all these units that we'll be discussing from now on, they could be a part of a hospital, they could be a part of a medical center, or they could be standalone facilities altogether. Like we
May
did.
I say something? This is
Yes, yes.
Anand Pandey, just very quick. All
Yeah.
right, just to differentiate between three things you just mentioned, right? If some thing critically happened to a patient, right, where exactly the patient should move in. In the United States, there are three main things which you need to think about when such scenario happen. The first thing is called hospital, of course. The second thing, under the hospital, there is the ED, which called emergency department. And under ED, there is ER, which is emergency room. And then there is a trauma unit. And trauma unit is a group of specialized resources who can provide the healthcare service, like surgeons, ER nurses, and different care managers. So just remember that.
Yeah.
Okay.
No, yeah. Yeah. So that is what we are coming up.
Thanks for adding that. Yeah.
Thanks for adding that. Okay. Just now, please continue with the department.
Yes. Okay. So yeah, as we were discussing, all these departments, all these units that we've been talking or we'll be talking about, they could be a part of a hospital or they could be standalone facilities altogether. Just like we did talk about the let's say primary healthcare clinic. This could be a standalone facility altogether. Could be a smaller space, but yes, they can work independently. A doctor's or a physician's office, yes, again, they can be working independently, and they could be standalone facilities. Ambulatory surgical center, again, it could be a separate facility altogether. But
now remember one thing, these doctors' clinic, they also have nurses working in. I mean, if I'm a doctor, I have a clinic and I have a bed right there where I'm checking the patients. I have, a receptionist and a nurse working for me, right? So that nurse is not trained and, does not have certification to work in an ICU. Okay. So remember where and what experience you are submitting to the clients, that is going to, make a huge lot of difference when you get an offer or not. Okay. So if you're, remember, if you're going to, pick up a nurse is a nurse, right? You can't pick up a nurse from a doctor's office to work in a hospital, and that too in an emergency department, right? So that nurse would not have experience dealing with the emergency cases, that the nurse working in a doctor's office would, have experience putting on a cannula, giving the injection or, reading out the doctor's prescription or just helping out the patients a little bit, right? But make sure that, the clients that they are going to send us the requirement, if they are asking for the emergency room experience, that nurse has to have that emergency room experience. You cannot just put a nurse from a pharmacy or a doctor's office and submit them into an ICU. That is not going to work, right? It's just like, you are submitting a Java developer to, do the SQL coding. Does that make sense to you?
Quick question.
Yes.
Do they need to have like a certain license for certain things, or it's just based on experience?
To be an emergency room nurse, yes, you have to have that certification. It's not the license. There's a difference between a certification and a license. License that allows you to work in a state, and the certification is that sort of a training that you're trained to work into that department.
So there's certain certifications. So when you were trying to recruit a nurse, instead of say, hey, what type of license do you have? Do you say what kind of license do you have and what type of certifications do you have as well?
Yes.
Should we say that instead?
Yeah. So moving forward into this training, we are going to train you on what nurses will have what certifications.
So usually, I mean, the job descriptions that you will see, they will clearly mention what sort of a license these people need to have. And if they require any certifications, that is also going to be mentioned. So there's a certification which is known as BLS, or the full form is Basic Life Support. So that is a certification that anybody and everybody working in a hospital setting, they are supposed to have that certification. And it has to be through the organization which is known as American Heart Association. In short, we call it AHA. But other than that, depending on which unit they are working in, what sort of age group they are going to be handling, so they may require some other certification. So we'll be talking about that part as well in a different session. We'll show you how those certifications
Thank
look
you.
like and how do we verify or how to read those. Yeah.
Yes, Ritesh, you were asking something.
Ma'am, is there any requirement for year of experience? Like, do they need to have like
Yes.
certain
Yes.
minimum year of
Yes.
experience?
Yeah. The client will let you know. The client will let you know in the job description what sort of experience they need. So make sure that you read the job descriptions before you start jumping on, searching the resumes.
Yeah.
Okay.
So that's where we prepare ourselves before we start even working on a job, when we start recruiting. So before that, we have to prepare ourselves in a way that we read the entire job description carefully. Like what all responsibilities would this person have? What kind of licenses, what kind of certifications do they need? What type of shifts are they going to be working in? Whether it's a day shift, it's a night shift. Are they supposed to be working on a weekend? Are they supposed to be working on a holiday? So
Every detail.
every detail would be listed on those job details that will be shared with you.
Okay. Does it answer your question, Ritesh?
Yes, sir.
Okay. Just please continue with the urgent care.
Yeah. So the next kind of a facility that you may see while you're recruiting, it's known as an urgent care clinic. So an urgent care clinic would be a place where patients can go when it is not a life-threatening situation. Let's say somebody has a strain in their ankle. Somebody wants let's say somebody had an injury and this person requires stitches or maybe a little wound care. So for such scenarios, they can go into this urgent care clinic and get their treatment done and they can come back home. So, but we always have to remember, if it is a life-threatening situation where a patient requires advanced level care, then these urgent care clinics would not be sufficient enough or equipped to treat those patients. In that case, they will refer them into the hospital.
They are more like the outpatient, urgent care where you get, treated quickly and come back home. I mean, these centers are not equipped enough to accommodate the patients or give them the admissions and do some critical surgery. So these are just a small, maybe I'm sitting in this room, I have this urgent care center, right? Somebody who knocks my door, and say, hey, I got hurt here, just put some, stitches and some, patches and I'm done. Yeah, this is what the urgent care is all about.
Or let's say somebody, it's summer season. So let's say somebody is suffering from dehydration. So in that case, urgent care clinic can help them. Patients can go in if they need some medication, or let's say a doctor wants to keep them under observation for a couple of hours, then yes, urgent care clinics can help.
Get some vaccinations, flu vaccinations.
Yeah.
So all those of small, things, but these are not hospitals. They are just the urgent care clinics. So remember, any nurse working in the urgent care center is not ready to work in an emergency room in a hospital.
Yeah.
Right?
And the reason they people have to choose it very carefully where they have to go, it is because of the cost involved. So let's say if a person, if a patient has to go into an emergency department, the cost involved is going to be comparatively higher. But if it's not such a serious situation, the same patient can go into an urgent care clinic, and the cost involved to get the treatment will be comparatively lesser. So it is very important for people to use their insurance wisely, because these hospitals, I mean, I don't know if you've ever gone to bigger hospitals where the fee is comparatively higher. For the same cause, if you go into a smaller place, the cost involved will be lesser, but you'll still get the same treatment. So it's just like that. Rupesh, your question.
Ma'am, actually, I was just asking that the client will mention that that he or she needs a urgent care nurse, right, ma'am?
Yes, yes. They will mention what type of a facility it is, what kind of an experience they need. So yes, it is going to be mentioned on the
Everything is going to be in the job description, but make sure that you read the job description. This is what this training is all about, right? When you read the job description and the client needs somebody from an urgent care. So yes, you cannot submit a nurse coming from a heavy emergency room department to an urgent care. So emergency and urgent care are two different things, right?
Yes.
So you cannot just pull out a nurse from working in a hospital where it is so busy. Every second there is a dead body or a that strangled body coming into that emergency room or the trauma center. You cannot pull out that nurse and put into the urgent care clinic, right? So it's a very small segment. Yeah. Okay.
Yes.
All right, Jyotsna, please continue.
Yeah. Should we watch a
Excuse
little
me, ma'am.
video on urgent care?
No, that's okay. I think this is something.
Yeah.
No.
Okay, we can skip. But I'll share these tutorials with you all. So make sure you watch it.
Okay, so the next one is very
I
important,
think
guys.
Hema was trying to say something.
Hema, you are saying something?
Yes, ma'am. So as it was mentioned, like urgent care clinic, it's like a very temporary case. So what if a person visiting urgent care clinic and is like I mean to say any insurance policies tie up with this, like because yesterday you mentioned that outpatient and the secondary care can fetch insurance policies and all. So will it be related same with urgent care clinic?
Yes, I mean these medical insurance that people have. So depending on what sort of a plan they opt for, they can avail their insurance if it covers urgent care clinics or any other.
In India, your policy will only work if you are admitted at least for 24 hours.
24 hours.
Right?
Yeah.
In US, it does not work like that. You can take your policy, medical policy. You have various different plans, right? You choose one and you go and the insurance works there too.
So there are different sort of plans. I mean, it could be a basic plan, it could be a silver plan, it could be a gold plan, there could be a platinum plan, depending on how much they are paying, because they'll still have to pay for all the insurance if they are opting for it. So if they are paying more, then obviously the kind of services they can avail will be a lot more. And if it's just a basic plan, then yeah, the services would not be too many.
Okay. Yeah.
All right. So the next topic that we are, guys, if you have any questions, just don't raise your arm like this. Just because we can see Hema on screen, so we were able to make out that she wanted to ask something, right? Because we are onto the screen and we cannot see everybody on one screen. So just
we may miss on those.
Yeah, unmute and speak up if you have any questions.
Okay. Anand wants to say something. Please go ahead.
No, I just wanted to share one of the scenario associated with the urgent care you just talked about.
Sure.
And, in some situations, what happened that, you may have good insurance. You may have a primary care, a physician associated with it, whether it is HMO or PPO. What happens that it's sometimes harder to get their appointment in an urgent basis, even if you suppose having a cough throat or having pain in your eyes, right? Or suppose you have eye flu or something. You may not get right away your appointment with your physician, with your doctor, which is your primary care doctor, right? The first go-to doctor or general doctor you may be seeing it. In that case, sometimes, patients do prefer to go quickly to an urgent care and get their treatment. And that will help, out the patient right away. Again, it's going to cost a little bit more in compared to what they have it with the, primary care doctor visit or primary care clinic visit or the office visit. But this is going to help the patient to get the treatment or get the service they are looking for in a right away within an hour basis when they visit to the urgent care unit. So just wanted to share with the team a particular scenario that do happen, but that's not an everyday basis. This is some rare situations or the conditions which may occur and let the patients visit the urgent care and see the urgent care's specific nurses who can take care of wound cares and some other type of services as well.
Right.
Thank
So,
you.
I mean, anybody who requires immediate care, they can go into the urgent care. Yeah, rightly said. Okay, so the next category that we'll be talking about is an acute care.
Guys, I want all of you to pay your 100% attention here, because the maximum number of jobs, the high-end paying jobs, they all come under the acute care.
Acute care, yeah.
And this is going to be a little tricky for everybody to understand. So please pay your 100% attention here.
Yeah, if you want to make more money, then this is the area
Yes.
you
Yeah.
should be focusing on. So, acute care, anybody has an idea what could be an acute care? Anyone who wants to give it a try? What could be acute care?
For a short period of time, the treatment is required.
Okay. What else could be acute care?
Therapy centers after surgeries and all.
Not really. Anybody else?
It's basically for urgent medical conditions.
Urgent medical conditions. Okay. Yeah, that is right. Anyone else who wants to give it a try? It's okay. I mean,
Like
even
real-
if you're wrong, that's okay.
Like
Yeah,
real
it
delicate
critical
procedures.
condition.
Sorry, Gerardo,
Like real delicate like conditions where they need extra attention. from
right,
delicate
extra
situations.
attention. If somebody needs extra attention, that's right. Prem, you were saying something?
Yeah, I just said it deals with critical conditions like heart attacks and then so on. The
That's
emergency.
right.
Yeah.
Right. That is
Like
true.
working with a good doctors with a good experience.
I think every doctor is a good doctor. I'm sure,
Yeah.
according to them, they are good doctors. But
Like
acute
specialized
care,
doctors, ma'am.
huh?
Like specialized doctors. Like a
Specialized.
person only looking for a heart, a person only looking for a for a tooth. So it's like a specific doctor, and a nurse is working under a doctor with a good experience. Like she would
No.
No.
Abhishek, you are
So
taking
that's
in the
a
wrong
generic
direction.
statement.
That's a very generic statement, and that is we are talking about the acute care here. See,
Yeah.
acute. What do you mean by word acute? Acute care means that needs some extra care, and the department that you see on the just can you just protect your privacy from sharing sensitive files or whatever? Can you just end this? What is this on your screen?
Yeah.
I wanna.
Okay.
Yes, Teresa, please.
Yes. What I know about that is when you had an accident, or example, you have a big car accident, you go to after the doctor in the hospital, so emergency, you go to therapy and the chiropractic and the team to different kinds of specialties, but by different out to the hospitals, like a therapist, like I mentioned before. And all these things, like somebody need to go to clean the people in the house or follow that medication and everything. That's what I think it is.
Yeah, I think that's a long process that you've covered. So yes, the beginning part that would fall into the acute care. Like somebody had an accident, that's the right part. So acute is also known as critical. So anybody who is critically ill, okay, there could be any sort of a situation. A person may have had an accident, a person may have had stroke, a person may have had cardiac arrest, a person may have had brain injury, a person may have had loss of limbs, a person may have had severe burns. So any sort of a situation where patient requires extra attention, immediate care, and they cannot live without the machines, that is where the patient would be kept in an acute care setup.
Now,
So acute care.
Now, if you read this, acute care is a branch of secondary healthcare where a patient receives active but short-term treatment for severe injury or episode of illness, an urgent medical condition, or during recovery from surgery. Acute care services are generally delivered by terms of healthcare professional from range of medical and surgical specialties. Acute care may require can you just a stay in a hospital emergency department, ambulatory surgery center, urgent care center, or the other short-term stay facility, along with the assistance of the diagnostic services, surgery, follow-up, outpatient care in the community. Now, Joseph, can you please scroll up a little bit? I want to put in this. So acute care is a term where all of these care falls under acute care. So urgent care that we just studied, and emergency care, short-term stabilization, critical care, trauma care, acute care, surgery. So, something that is very urgent to attend to, that needs, the acute care of the patients. So that is what we call as acute care. Okay. So when you are going to receive, the jobs for an RN with acute care experience. So remember, they will also ask that this nurse should be open to float into any of these departments. Right?
Yes, can it be done in any house? It has to be done in a big hospital, correct?
Yes, it can be. Yes.
It has to be done in a big hospital, right? Where they have certain equipment and everything, right? Not just any urgent care or anything like that, correct?
Yes, true.
That's right. Yeah.
So, when you receive a requirement, it will clearly say they need a registered nurse in San Diego, California, and that nurse should have the acute care experience working in an emergency department. Right?
So yeah, acute care is a broad term.
Yeah.
It's vast. So it has multiple subcategories, or I would say different units that still fall under the acute care setting. So
right.
that's
in the job description, you would also see that this nurse should be okay to float into trauma, acute care, urgent care, emergency. So, so now you understand what the acute care is. Anybody who doesn't understand on this call, what is an acute care? Clear to everybody?
So I think that they have a basic idea about the acute care by now.
Yeah, they have it. Okay, scroll down. Just now. Let's continue.
I think somebody was trying to say something. I heard someone.
I have a question.
Yes, Shilpam.
Yeah, I want to know if a nurse have a certification of acute care. It's like if someone have a certification of emergency for the emergency department, then that nurse can work in the trauma centers also, or there is a separate certification for trauma centers.
Okay,
or if someone have a acute care
let me tell you,
certification.
acute care is a Shilpam, acute care is a term. It's a common term given to the
multiple units.
To multiple units. Okay. So somebody who's working in an emergency room will have different sort of certificates, right? Somebody who's working in an ICU would have different sort of set of certificates. So we are going to train you on that part. So that part is coming up in the moving forward in the training. So we are going to let you know what are the job titles, what departments they are eligible to work in, and what sort of certification they would have. So this is just the departments we are covering right now. So we'll come to that job titles and the certification part later on in the training. Yeah.
Yeah, sure.
Okay. All right.
Yeah.
Okay. Just please move ahead.
Okay, so under acute care, as we already read, urgent care clinic can also be a part of acute care. But yes, as we discussed, they will not be handling any cases where situation could be fatal. A person has a life-threatening issue, then urgent care would not be equipped enough to handle such cases. But if it is a life-threatening situation, then they may have to move the patients into, let's say, whenever a patient enters the hospital and a patient has had a serious injury, let's say somebody had third-degree burns. So in that case, the patient will directly be moved into the emergency department, and there will be a team that is going to be handling that. Let me actually move down to emergency first. Yeah. So if a patient has had third-degree burns, so the team of healthcare professionals will be available immediately to help that patient. They'll try and stabilize the patient. They'll probably give them the first aid. There will be a physician. There are going to be nurses. There will be respiratory therapists if a person is not able to breathe properly. There could be nurse practitioners and many more. So there is a team that works in the emergency department. So they'll be so their job is basically to provide the first level of care to the patient, and they try and stabilize the patient. So once they are a little stable, depending on how the condition is, what sort of further treatment should be given, they will decide where should they be moving those patients into. So there are specialized units after the emergency department. So let's say we were discussing about a burn case. So after they've given the basic level of care to the patient in the emergency department, they will be moving that patient into the burn unit. So there's a special unit that deals with burn cases. Now, let's say there is a case where the patient has had a heart attack. So in that case, the patient will be moved into the emergency department initially. They'll try and stabilize the patient. Again, after they've stabilized, they'll move that patient directly into the coronary care unit or the heart specialized unit. Or if the hospital doesn't have a specialized unit, they may want to move such cases into the ICU. So ICU is a unit which is capable enough to handle patients where they may have to be kept on a ventilator, or they may have to be kept on track tubes, or they may be kept on different sort of machines that may be needed for them to be kept alive. So, but at the initial stage, the patients would go into the emergency department, and from there on, they'll be moved into different units. So this process of deciding, so there are specialized people. There could be a nurse who specializes in deciding where should we move these patients. I mean, there has to be somebody, right, who's deciding on where do we move these patients. A patient would not be able to choose on his or her own that, I'm here in the emergency department, and today I would like to visit an ICU. Oh, no, I would like to visit a heart unit, right? So there is a specialized person who decides which physician should be consulted, which team should be working on that patient, or which unit should be assigned to this particular patient. So this process of prioritizing and figuring out where the patient should be going, this process is known as triaging. So the spelling of triaging is T, let me actually write it here. So triage, or that's the process. So you may receive certain jobs where they would need a triage nurse. So this nurse will be specialized in figuring out where do we assign these patients. Let's say there are 3 patients at the same time. So they have to prioritize which patient needs immediate attention. If the second patient can wait for a couple of minutes, then they will probably assign the team to the first patient. But if both the patients require attention at the same time, then they would have to be assigned teams immediately. Patients will not be able to wait. I mean, one experiment and the patient may not be alive for another experiment. So they have to be very strict. They have to be very accurate on deciding where to go. So the emergency department, it's usually the busiest department in any hospital. So as we discussed, so anybody who has lost, let's say somebody who's unconscious, somebody who's had acute confused state, anybody who's had fits that are not stopping, severe chest pain, somebody with breathing difficulties, anybody who has had severe bleeding, severe allergic reactions, burns, or scald. So such cases should be moved into the emergency department. And then from there on, they'll be moved into different departments depending on how the physicians plan their treatment. So this falls under emergency department. And similarly, so under emergency department, if there are any cases of injury, let's say somebody had an accident, somebody probably fell through a height, or somebody had a serious injury. So all of those cases from emergency department, they'll be moved into the trauma department. So at the same time, it also depends on the kind of services these hospitals they may have. So just like any busy city, there could be a bigger facility, there could be a bigger hospital. They may have advanced level resources, but there are remote areas too. You know, the entire US, it's not full with busy cities. There are areas where there could be a smaller facility that is covering up to a couple of miles. So if those patients, I mean, people living in that area, if they require medical services, they may have to go to a nearby facility, whichever is available. So they won't be rushing down to the busy hospital, which could be, let's say, 200 miles away, because it is going to take them too long before they can actually get the medical treatment. So depending on what is available nearby, they usually choose. So we will also have jobs in remote areas. So we'll have to convince these nurses or these allied professionals that we'll be working with to take up jobs in those remote areas too. So how do we do that? That is also something we'll be talking about at length. So there will be separate sessions on how do we convince them, how do we screen them, what sort of questions are you supposed to be asking them. So there will be a separate session on that. But always remember, it's not always going to be a huge hospital, let's say 1,000 plus bed size facility. There could be smaller hospitals with, let's say, 50 bed size, 100 bed size, depending on which area they are in. So there could be some areas where they just have community level hospitals, or India, we call it dispensaries. There could be just smaller clinics available. But let's say if there is a hospital which can provide just the basic level of care. So if they are not able to help the patient, then they will have to transfer those patients to a bigger facility, whichever is available close by. So depending on the size of the facility, they may have separate units altogether, or they may have a small floor where they are dealing with all sort of cases that may be coming up. So any questions, any doubts so far? Okay, so let's move on to the ICU. So ICU, again, it falls under acute care. there are I mean, we also call it intensive therapy unit, or it is also known as intensive treatment unit, or we also call it critical care unit. So whenever you're about to create those searches, when you'll be recruiting for these candidates, so these are different keywords that you can use. You can use the full name, let's say intensive care unit, or you can use the word intensive care. You can also use the short forms. So any of the synonyms can be used while you're trying to create those searches. So as we discussed, ICU will be a place where patients who are critically ill, patients who can probably not survive without the machines. Let's say a person could be on a ventilator, a person could have tubes attached through the throat, a person could have let's say a person could be on dialysis throughout the day. So there could be different scenarios, but imagine somebody in an ICU. There are high chances that this person is not going to be conscious. This person is going to be unconscious. So once they feel, I mean, once the doctors feel that yes, this person is becoming stable, so they may move them into a different unit, depending on what sort of a treatment plan they'll be doing for that patient. So sometimes, the patient may still require extended care, but ICU, I mean, they would not need services which are given in an ICU, but they still require acute services. In that case, these patients will be moved into a unit which is known as a step-down unit. So step-down unit, it is also known as a progressive care unit. So that is a unit which takes the patients from ICU. So their situation is comparatively better than being in ICU, but they are still not stable enough that they can be moved onto a general floor, or we call it a med-surg floor.
So guys, remember these words that Josna is talking about. Step down. You will get so many requirements from the hospitals for the step down unit. Okay.
So if you want to remember it, just try and remember it in a way that ICU, that's at the highest level. And if the patient needs to be kept in a unit where they don't require that advanced level of care, so one step down from ICU. So that's how you can remember. Or we can also try and remember it that they are progressing. I mean, their health is in a progressive stage, so they can be kept in a progressive care unit. So we do get a lot of jobs where they may have to work in a PCU, the short form progressive care unit, or it is also known as step down. Let me actually go down. Yeah.
Would it say step down? Sorry, would it say step down or progressive care? Would it say either or? Would those words actually be mentioned?
They're one and the same thing.
Okay.
Yeah. So let's say if they need somebody who's going to be specialized dealing with patients with heart cases or cardiac cases, so they will mention it that they would need a person to be working with cardiac patients. So these step down units, they can also have patients. Let's say somebody has had a kidney failure. We also call it renal failure. A person may have had stroke. A person may have had burn injuries. But once they start becoming a little stable, so they do not require services from an ICU. See, ICU, any patient, if requires ICU services, it usually has to be for a shorter period of time. But if they require extended care, then they can be moved into the step-down unit. Again, the cost involved for keeping somebody in an ICU is going to be comparatively higher. And in step-down, it's going to be a little lesser. Now, there could be...
Step-down is not going to be just like those general ward. They move you into the ward, right? Step-down is going to be, close to an ICU, but this is not an ICU. ICU
It's
means
somewhere
extra
in
care.
between an ICU and a med surg floor or a general
Med-surg
floor.
or a general floor, right? Okay. And Gerardo, to your question, yes, many hospitals, they write it as progressive care unit, they write it as intermediate care, or they write it as the step down unit. It's one and the same thing.
Right. So any
Thank you.
questions or any doubts from anyone? So other than these few people, other people are not banned.
They are,
Hey,
Asking
Samir.
questions.
they are super.
Samir, one of my employee, Aline, see, not in camera. Make sure everyone in camera on because they're working remotely. So make sure they on. And if they're not on, I just please let me know. Okay. Because I'm seeing here this picture on and she not, I messaged her, but camera is not on. That means
Yeah, I mean,
something
because I just
not
can,
serious.
I'll just tell it once because I just I have to concentrate on my training, right?
No. So you concentrate, but make sure you make someone can Sid, someone can note for whoever not in camera on and send it to me later on.
Okay.
See if she's there, she will talk. It look like she's not there. Put the picture and out.
Yeah, that's the major reason we want
Yeah.
everybody to keep the cameras on, so we are able to understand if you're actually there or not.
Yeah.
Are you able to understand or not? Yeah. So
So make sure all question asked to her, Eileen, if she come back. Okay. Let's see.
okay, looks like she's not there. I mean, otherwise she would
Not
have.
there. Yes.
Yeah.
Right. Sorry, right. Says I don't want to micromanage, but I have some people like making me very crazy, running crazy. Okay, anyway, I'll continue. I'm not going to disturb you. I'm working myself. Okay, other things.
So I still see a couple of more people who have the cameras off. So it's a request, please turn the cameras on. So it's easy for us to figure out, even after looking at your expressions, we are able to understand if you're able to grasp things or not.
Head of the departments, they are doing other things. Only they join because they want to see their candidates join or not. So, so like said, me, Ram, Bipin, okay, Karan. So we exceptional, and my wife Stephanie.
Sure.
Okay.
Yeah, I think
Right.
for a couple of people it is okay, but somebody who's here to learn, I think you guys should keep the cameras on.
Yes.
Yeah.
Thanks.
Thank you, Vikash.
All right. So, guys, is it clear for the step down unit? It is one step down from the ICU. Yes, Suchi.
Yeah, Samir, I have one question. For example, one nurse who is working in ICU. So can she also work for the step down or like PCU unit?
These nurses have, different sort of experiences, but yes, somebody who's working in an ICU and that nurse is, asked to float into the step down unit. Yes, they can.
Okay, so as you told, like, yeah, we'll be having the class pass certification, but does it require different certification as well to work for this two
It
units?
requires experience, not the certifications.
I think they would just need ACLS. That's it.
They, we will cover that part, Suchi. So I know, all of the experienced people here in the recruitment, they would have, several questions on this one, but we will come to that part. Now, for now, we are just learning the departments. We will come to those job titles and we will let you know which departments they can work into. Yeah.
Done.
Okay.
Thank you.
Okay. Then following the step down unit, there is a peri-operative unit. See, it's not pre-operative.
Semi Peri, I think before that we have to cover a few other units.
From the step down unit?
No, not from the step down. I mean, we are discussing.
You haven't discussed those. Okay, all right.
Yeah,
okay.
that
Yeah,
part is
sorry. Go ahead.
Yeah.
Yeah.
So I just moved on to the step down because it was somehow related to ICU.
Oh, okay. Sorry. Please go ahead.
Okay. So now that we've learned what an ICU is, Samir, should we show them a couple of videos?
Yeah, we can show them, but don't let them watch the complete video because we have shortened our training time to just 11:30. I mean
Yeah.
3.5 hours. So, you
Or
know,
maybe we can share the document with them. So whenever they get time, they can watch the videos.
yes.
I think
We
that
should continue with the training first. Yeah.
Sure. So ICU, remember, adults and the elderly patients, if they require intensive care, if they require critical care, in that situation, they'll be kept in an ICU. Now, let's say there's a newly born baby. Okay, let's say that there was a premature baby that was delivered this morning, and this baby had some complications. Let's say this baby has a hole in his or her heart, or probably the organs have not developed properly. So in that scenario, the doctors, the nurses, they may want to keep that baby in an ICU. So it's pretty evident that an ICU that is equipped to deal with adults or probably elderly patient would not be an appropriate place for a newly born baby because of the size of the machines that are available. You know, for adults, the size of the machines will be huge, but then a newly born baby, I mean, it's already so tiny. So the machines that are supposed to be used on them, they are also supposed to be smaller in size. So there is a specialized unit for newly born babies if they need extra care, if they have to be kept in the intensive care. So there is this specialized unit that is known as NICU. In short, we call it NICU, or the full form is Neonatal Intensive Care Unit. It is also known as Intensive Care Nursery. So any word that you may see on a resume, it would still mean the same thing.
Now remember, a nurse working in a NICU cannot work in an adult ICU because of the experience, right? This nurse has experience dealing with critical cases that are in the ICU, those small babies, newly born babies, but that nurse would not have experience to deal with the patients who are into the ICU, the adult population. Does that make sense, everybody?
Yes.
Yeah. Okay.
Okay. So as we said, there's a specialized unit for newly born babies or premature babies or somebody who requires that care. So NICU is a place. So there's this device which is known as incubator. So usually these babies are kept in an incubator. If they are not able to breathe properly, they may be kept on ventilators or any other devices that may be needed. But as I mean, by now you all know that it's not just one person's job to provide care to these patients. So there's a huge team that provides care. There are physicians, there are nurses. When we talk about nurses, there are different kinds of nurses depending on their education level, depending on the kind of licenses they have. So there could be different sort of nurses. There could be an RN, there could be an LPN, there could be a nurse practitioner, there could be a nurse assistant. So nurses are also different there are different kinds of nurses. Along with it, there could be respiratory therapists, there could be dietitians, there could be a lot of other professionals who work as a team and they collectively provide care to the patients. So this is something that you'll be hearing almost on a day-to-day basis. So next, now that we've learned that there's a specialized unit for adults, there's a specialized unit for newly born babies. Now there is a specialized unit for children. Okay, so this unit is known as Pediatrics Intensive Care Unit, or in short, we also called PICU. So you will see a lot of resumes where people may have mentioned NICU, PICU on their resumes. So they just don't call it NICU. In short, they call it NICU or PICU. So PICU would usually deal with all the children. So any questions so far? Okay. Next, there's a specialized unit.
One more thing I want to add here.
Yes, please.
So, to your question, Gerardo, nurses working in the ICU, then nurses working in the NICU, the nurses working in the PICU, and these all nurses will have different sort of different set of certificates that we will cover in the later part of this training. Okay.
Would they have a step down for these type of for the PICU or the NICU as well, or no?
Sorry, I didn't get your question.
Would they have a step down too as well for these
the
for, like,
step down
infants?
you're asking about?
Yeah.
Step down? No, step
Yes.
down does not work into the NICU and the PICU.
No, they don't.
Okay.
Because this is a specialized skill, right? NICU is for the people who come out of the ICU, and for the NICU, for the neonatals, they have separate step down unit, right?
Yeah.
And for the PICU,
Okay.
they have a separate step down unit for the children, right? Does that make sense?
Understood. Yes, 100%.
And there's one thing, anybody who has always worked in a step down unit, but never has worked in an ICU, so this person will not be a fit to work in an ICU if they do not have an experience, because they will not be able to treat the patients in an ICU. But if there's somebody working in an ICU, they can still work in a step down unit.
Right.
Because-
And all these units would have different set of certifications that they would need.
Yeah.
All right. Just please continue.
Yes.
Samir, one more thing. I have one question. Sorry to interrupt.
Sorry, go
So,
ahead.
as you told for NICU, like NICU, so I have seen when my care, she was ill. Okay, while she has taken birth. During that, so there is 3 levels in the hospital. Like they have put it as NICU level 1, 2, 3. Like when she shifted to 1, then after a couple of days, like 4 or 5 days, then she shifted to level 2. So that I'm not sure whether it's in USA the still same or it's only one department is there, but I have seen in India it's like they're having 3 levels based on the criticality of the care.
It is in the hospital to hospital, understand,
Yes.
right?
I think it would depend on
Yeah.
how big that facility
If
is.
you come to Apollo in Delhi, they will have just one, place
Okay.
they have to treat, right? I mean, they're not going to be having 1, 2, or 3 level. I mean, trauma level 1, 2, and 3, yes, they are different, but in a NICU,
Yes.
you cannot have 3 levels of different NICUs. It depends on a hospital, probably, this
How big it is?
might not have that incubator. Okay, take her to the next level where they have the incubator. If they do not have an incubator there, they will take it to some next level. So probably it depends on the hospital to hospital, how that hospital is set up. But in general, a NICU is a NICU. There are no levels to it.
Or, I think,
Understood.
Samir, maybe some hospitals that specialize into the obstetrics, where they
probably.
would deal with all cases of family planning, pregnancy, childbirth, post birth. They may have advanced level of NICUs like level 1, level 2, level 3. But if it's a general hospital where they treat almost every type of a case, then they may just have 1 unit. So it totally depends on
Suchi, if
what
somebody
they
goes in
specialize.
there like you did not have knowledge of healthcare at that time, right? So you go in there to explain to you. They are not going to tell you they are going to take that child to which unit. They will tell you we are taking her to level 1, level 2, level 3, right?
Correct, yeah.
To make you understand in that layman term, because they knew that you would not know if they start talking that healthcare language with you. At that time, you would have not understood that, right? So
Correct, yeah.
it could be a possibility, but a NICU is a NICU. There are no levels to it.
Okay, got it.
Yeah. Okay. All right. Just now, please continue. Does it answer your question, Suchi?
Yes, that's perfect to me. Thank you.
Right.
Okay.
Thank you.
Does anybody need a break?
Yes, everybody needs a break. I can see that on their faces.
Yeah, I think they've been on this call for 2 hours. Maybe we can give them a little breather.
Okay,
Yeah.
please
10 minutes?
take 10 minutes and because we are wrapping up this training in just 1 hour or so. Just come back quickly, okay? 10 minutes.
Okay, so let's move ahead. Let me share my screen. Okay, so the next unit that you will see that still falls into the acute care, it's known as CCU, or it is also known as Cardiac Intensive Care Unit, or CICU. It's also known as Cardiovascular Intensive Care Unit. So any patient who has had a heart attack, unstable angina, cardiac dysrhythmia, or any other cardiac attention. So in layman terms, any patient whose heart is not functioning properly. If they've had, let's say, an open heart surgery, or somebody has had a stent installed into their heart, or let's say somebody had a bypass surgery. So all of those patients, after they are done with the surgery, they are usually kept in an ICU. But this ICU is usually known as Cardiac Intensive Care Unit. So they specialize in treating the patients with heart-related cases. And there's another term that is commonly used. It's known as cardiac for heart-related cases. So any questions or any doubts on that? I think it's just simple for you to understand. If it's a heart-related case, if they require critical care, then yes, there's a specialized unit. So you will have those jobs where clients would need your nurses to be working within an ICU, which specializes into cardiac cases. So they would require CVICU, it's known as cardiovascular ICU, or cardiac intensive care unit, CICU. There could be a different name, but all of those mean one and the same thing. So if it says cardiac, that means it's related to heart. Now, similar to the cardiac unit, there is another unit which is specialized into the neuro cases. So neuro cases, as the name suggests, anybody who has issues, or I would say, let's say somebody who's had a neurosurgery. Neuro is all related to brain, or it's related to nerves, or let's say somebody who's had a brain tumor, stroke, rattles, snake bites, or any other neurological problem. So if they require intensive care, then yes, this is the unit that specializes in providing them the care. So neuro ICU or neuro intensive care unit, it's one and the same thing. Any questions? Any doubts? Anyone?
Why snake bites? Isn't this wait, you said it was with the brain, right?
I'll have to Google that. I'm also not sure what it is. So let's just take a look. Rattle, snake bite. I think it's constricting blood vessels near. Okay, so probably when a snake bites. So yeah, just to treat patients.
Right, it is very common. Oh, sorry, I was just
Please go ahead. Go ahead.
Just to let you know
it's very
that
common in the deserts, right?
correct, exactly.
Right.
Texas
Usually
area
installed
and all
from
that. It's
Texas, Arizona, probably. Yeah.
That's why they have a specific, sections. If you have that, you can just go in and they will treat you right away, because you need sometimes right away treatment on that. Some are very venomous, means very poisonous, and they just, if you don't treat it right away, you will go in unconscious condition very quickly. So that's
Right.
why they,
I think
but
in
not everywhere.
Grand
You don't
Canyons
see
and
this.
these areas and the parts of Texas where it's Arizona connected to the desert side, so you find these sort of snakes there, these rattlesnakes.
Yeah.
Yeah.
Okay.
Yeah, they're
So
in San Diego too.
San Diego too. San Diego is not a desert, man.
It is considered.
Oh,
desert.
it's entire California is desert only. They just
Yeah.
built it like that it looks green and nice and all. But you know,
Like Vegas, built in middle
yes,
of the desert.
Vegas is more desert. You know, it's more on that side. And California is built in a way with lot hilly terrain, and it has the ocean close by. So that's why you don't feel that. But it's actually desert only. We have drought all the time. I mean, this year we have a lot of rain, but normally, it's a drought state.
Okay, all right. Okay.
So yeah, okay, I think we've covered different types of ICU. First one was for adults. NICU is for neonatals. PICU is for pediatrics. Coronary care unit or cardiac intensive care unit, that's specially for heart. Neurological ICU or neuro ICU, especially for brain related problems or nerves related. Trauma, we've already discussed. Any sort of injury, it could be caused by an outside force, such as a motor vehicle collision or fall. So all those cases will be handled in the trauma intensive care unit.
Now, now you understand why, nurse working in a NICU setup cannot work in the CVICU, right? So these are very specialized skills. Somebody working in the cardiologic, ICU, somebody working in a neuro ICU, they both cannot work in, interdepartments. They have to, work, your heart and brain are two different organs, right? They have, specialized skills. Right?
Yeah, a
So-
doctor cannot, randomly go and say, oh, I'm not in a mood to treat neuro cases today. Let me try my hands on the cardiac.
I'm going to take out your heart and see what is inside, right? So you,
Yeah.
right. So yeah. So make sure that when this is a very specialized area, and you cannot submit a nurse who's working, in a NICU to work in a neuro ICU. So it is a very specialized skill. Okay.
And to add to it, there is going to be one more thing. When you read those job descriptions that will be assigned to you, they may mention certain types of cases that may have to be, people should have that sort of an experience. Let's say for an ICU, they may want to see some cases, candidates with, let's say, transplant cases, or they may want to see some candidates with the experience related to, let's say, abdominal cases, or they may want to see cases experience with the heart related problems. So you have to read the job descriptions carefully. So within an ICU, there could be different sort of cases. It's not just that we can generalize, but yeah, depending on what your client needs, you have to ask your candidate if they have that sort of an experience. So especially when they clearly mention it on the job descriptions, so you have to check with your candidates if they have that experience. So let's say if they need somebody with the heart transplant experience, and you have a candidate who doesn't have that sort of an experience, this candidate has probably worked with heart attack cases. So this patient would not be a fit to do that job.
Okay.
It doesn't matter if they have ICU experience, they've been doing it for 10, 15 years. But if the client has specifically mentioned that your candidate should have heart transplant experience, then we have to give them what they need.
Guys, I understand, all of you are new to healthcare, but when you start working in healthcare, there is one common thing that you will observe. There is a very, very high ratio of backouts. There is a very high ratio of terminations, right? And there is a very high ratio of rejections. The reason is we are asking you again and again that please do not submit, you know, a cardio ICU experienced nurse to the neuro ICU, right? Because the client is expecting us as an agency that we have done our due diligence and there are auto offers, you know, lined up. So they won't even talk to your candidates. They would just trust the Lansoft recruiters as an agency that they have done their due diligence. They have spoken to the nurse. They have spoken to the nurse about the location they are going to work in, the kind of patients population they are going to deal with, the departments they are going to be working in, and what are the expectations of those departments. I mean, the hospital will assume that the agency, we have done our due diligence. But here, under the pressure of our managers, you know, the team lead just sitting, you know, standing next to you, you know, when Suchi comes and tell you, I need submission. Okay, just tell her, please wait. Okay, I will give you submissions, but I will give you the right person to submit. Okay, so, you know, you have to set your expectations right. The leaders on this call, that please make sure when your recruiters are submitting the candidates, you are verifying it, you know, triple verifying it, that the nurse has the experience the hospital is asking for, and you are not you know, submitting candidates that do not have that kind of an experience, and the certification, the location, and everything. So please make sure you as the recruiter do your due diligence, because this healthcare industry is really, you know, critical. It is because it deals with the life of human beings. It is not any software you are dealing with. You are sending somebody who's going to be dealing with somebody's life. Okay, so the tolerance level of the hospitals is very less. If you make a mistake while, you know, coding a software, that can be redone. But if you make a mistake while giving that one injection to the patient, that patient can die. That person can die. Okay, so remember, you are into the business, you are entering into the business of saving lives. Okay, you are not entering into a business of coding and making any software. So you have to learn it very, you know, thoroughly, and make sure that you know, it's not a submission that is going out for you. Please remember this, right? It is not a submission. It is a nurse that you are sending to that hospital set, but that nurse is going to be, you know, saving somebody's life. So send your best nurse out there. Make sense?
Yep.
Yeah. Just now, please continue.
So if by mistake we send the wrong person, probably they'll just terminate that person on day one. So we don't want to waste our time, energy, efforts, and money on hiring wrong people. So it is very important for us to find right people. Yes, Anand. Please unmute yourself.
Sorry, I have multiple devices here. I'm just switching between those. Just curious to know that when we screen these nurses, right, for certain positions or certain specialized positions, do we have any template or something which we should consider? Because JD is something, right, which hospitals or our vendors will provide, and that have limited information. But on top of that, do we have any standard or some template which we should follow when we will, you know, specifically screen these nurses and ensure that, yes, these are really fit for this particular position?
Yeah, we have
and
built that.
they can really do.
We have built that, and we are going to, you know, share this with you. And also we are going to train you on this. This is called the 360-degree analysis document. And, you know, we will train you, all of you, on how to screen these nurses. So this is a full package of training that, you know, we are providing here. Right? We are going to train you on how to screen these nurses. There is a, you know, format that we have. There is an Excel. There is a set of questions that we are going to send to you. So yeah, before, you know, we end this training, we'll make sure that you become these, you know, core Healthcare recruiters.
Healthcare recruiters. Yeah.
Awesome.
Yeah.
Thank you.
Yes, Jasna, please continue.
Okay. So there's one more thing that I wanted to talk about. See, in healthcare industry, especially when we are talking about these nurses, there is one thing which is called nurse is to patient ratio. Okay, so does anybody have an idea what could be a nurses to patient ratio?
Like on 100 patients, like how many nurses are available?
Right, that's right. So nurses to patient ratio is usually what it means is one nurse should be handling how many patients. So depending on the kind of unit they're working in, the patients are assigned to those nurses. So let's say there's a nurse who's working in a clinic. So how many patients can that nurse handle at a time?
1:5.
Could be 1:5, 1:10, 1:20. Even if there are 50 people sitting out there, this nurse should be able to handle all of them, right? Because again, triaging comes into the picture. So they'll prioritize, or probably first come, first serve basis, or it could be depending on the severity of the situation. So they usually prioritize and they work with the patients. But now let's consider a situation where a nurse is working in an ICU. So what could be the nurses to patient ratio in an ICU?
1:2.
Yes, I think 1:2.
Yeah, it could be 1:1. It could be 1:2 at the max. So let's say at the same time, both the patients need a nurse. So how will the nurse choose which patient should be handled first?
Like which patient needs the
Severity.
help first. So nurse is going to
Who is
first
going through
assess
severe
that one,
situation?
and
Let's say
then
both of
another
them
one.
are at the same severe situation level.
On that
In that
place,
case,
she
the
might be
triage-
she might be telling someone to help her.
Yeah. So in most of the cases, if they have very severe patients aligned with them, they may just have 1:1 ratio. Or if the patients are not that critically ill, they may have 1:2. But usually for ICU, for intensive cares, 1:2 is the maximum nurses to patient ratio.
Quick question: wouldn't a triaging person be able to handle that? Like to see what's more like
Triaging
severe?
person will just align, but then
They will align to the okay.
yeah, let's say see there's a nursing station almost at every floor, and usually it's not that just one ICU nurse will be present on the floor. There will be backups. So there could be, let's say, 2 nurses, 3 nurses, 5 nurses on an ICU, depending on how big that unit is. Let's say if it's a 50-bed sized ICU unit, they'll have 25 ICU nurses probably. So not at all the time, all the patients would need those nurses. So if one nurse is busy attending one patient, either the supervisor or the triaging person may align another nurse with that patient. So that's how they provide care to different patients in an ICU. Anand, you want to say something?
Yeah, just wanted to mention that for California and Massachusetts, there is a law which specifically state that what should be the nurse versus patient ratio should be. I think for the other states, it's not at the law level, but still there is a guidelines for every hospital and all. But for those 2 states, how much I remembering from my memory, there is a law associated specifically for these 2 states. So as you mentioned, there is a federal law, which is applied for every single state, and then there is a state level law. And for California and Massachusetts, there is a specific law which mandate that every hospital should maintain this particular ratio in their clinics or in their HR emergency care, or if it is hospital.
Right, right. So, I mean, we hear it a lot from some of the nurses where they tell us that, my hospital is malpracticing. They're not working properly. Probably the nurses to patient ratio is so high that it will jeopardize my situation. It will jeopardize my license. I may have problems with my license. So sometimes these hospitals, they do such things. But yes, California is one of the states which is very strict on a lot of things. They are very strict on the laws. They are very strict on almost everything. That's how we can categorize. So you talk about the rates. California is very strict on that. You talk about overtime laws. There are separate rules and regulations in California. But in other states, comparatively, they are not that strict, or they're not so specific about certain things. So yeah, nurses to patient ratio is something that your candidates may also come and ask you. So if it is listed on the job description, you may tell them. If it's not listed, then do not assume that this is going to be the nurses to patient ratio. You may simply tell them that, you may ask during an interview, or you may ask your managers or supervisors to reach out to the clients to confirm the nurses to patient ratio. If your candidate is adamant about getting that knowledge or information before even applying for the job. So, but do not just assume that, it's an ICU. The nurses to patient ratio is going to be 1:2. Or if it's a med-surg floor, nurses to patient ratio will be 1:5. So I would suggest, do not assume, only give them the right information. If you do not have the information, just borrow some time and get them the right information by checking with your supervisors or managers or whosoever is available around you. Okay, so let's move ahead. Now, there's another category which is known as perioperative. Okay, so as the name suggests, perioperative would consist of 3 different stages. So operative is a word which gives us an image in our mind that somebody is probably planning for a surgery, right? Somebody is supposed to get a surgery. So in that case, they would fall into this category, which is perioperative. So perioperative would have 3 stages. One is preoperative. Second is intraoperative. And third one is post-operative. Preoperative, intraoperative, and post-operative. So these are the 3 stages that would be covered under perioperative. It's the short form is also peri-op. So any nurse who has an experience working in all 3 stages would be a fit to work in any of the units. They may work in a pre-op. They could be working in an operating room. They could be working in a post-operative care unit. But let's say somebody has experience working in just one of these 3 units. So in that case, this person will not be a fit to work in the perioperative, because perioperative consists of 3 different stages. Remember that. So see, there could be surgeries where they may be planned in advance, right? So in that case, a team of doctors, nurses, different therapists, and different technicians or technologists. They sit together, they plan the surgery in advance. They prepare the patient in a way that the patient is ready to be operated. So what they do is, I mean, whenever the patient is in the pre-operative stage, there will be different people reaching out to the patient. Let's say there could be a physician, there could be a nurse practitioner reaching out to the same patient, there could be a nurse, there could be a dietitian, there could be a respiratory therapist. So all of them, they usually reach out to the patient, they ask them a certain, a set of questions, they note down the patient history. They usually ask them if they have a history of any diseases, if they've had any sort of a surgery in past, or are they allergic to any sort of medications, or is there anything that they want to share before performing the surgery. So those are certain questions that they may ask. Physicians or other people, they may ask certain questions depending on their requirements. So once they are clear on those questions, they may want to have this person undergo certain tests. They may want to get this person done with certain blood draws, let's say blood tests, urine tests, or let's say if it requires an X-ray or a CT scan or an MRI. So they may suggest certain scans as well. Or if they require any other testing, then they will do all of those within the pre-operative stage. Now, let's say the surgery is supposed to be done tomorrow. So today is the day when they'll be preparing the patient in a way that they may probably get all the reports from those blood tests, urine tests, all the scans. Once they have all those reports ready, they'll study them, they'll prepare themselves in a way that they are ready to deal with any sort of complications that may arise during the surgery. And along with it, they also put the patients on certain medications. They may want to clean or probably remove the hair from the area that needs to be operated. They'll clean it, they'll sanitize it. They'll put this person on certain medicines before the surgery. In fact, before the surgery, these patients are not supposed to eat something. So they have to do a little fasting before the surgery. So once the patient is ready to be operated, so this person will have to be moved from pre-operative stage into the intra-operative stage. So this stage would also be when this person is taken into the operating room. So in India, we call it an operation theater, but in US, we call it operating room. Okay, so OR or operating room, so it's one and the same thing. So now, when the surgery is supposed to be done, let's say there was a surgery performed in the same OR just about an hour ago. Do you think this second patient should be moved immediately into the operating room for the surgery?
No, it should be sanitized first.
Right, right. Immediately, I think we should not. So there will be a set of professionals who will be working in the operating room, and their job is to make sure that they prepare the operating room in a way that the surgery can be performed properly without any complications. This operating room has to be cleaned, it has to be sanitized properly, and all those instruments that are supposed to be used on a patient, they have to be sanitized, they have to be cleaned properly. So there is a person known as a sterile processing tech. We also call them SPTs. So it's their job to make sure that they keep all the instruments clean. They have to sanitize. They can use a lot of machines. They could clean them using steam. They could clean them using certain chemicals. And once they have cleaned and sanitized all those instruments, it's their job to keep those instruments in a certain order nearby the operating room. So they have a little table or probably a place where they keep all those instruments in an order. So let's say instrument number 1 has to be kept at place number 1. Instrument number 2 should be kept on the, let's say, level 2. So that's how they should keep all the instruments in an order. So if during the surgery, the physician requests for XYZ instrument, they should not take too long to pass on that instrument over to the surgeon. So it is very important for these sterile processing techs to arrange those instruments in a particular order that they already have in place. Now, there's another kind of a professional that you will see on a day-to-day basis, which is known as a surgical tech. We also call them scrub techs or surgical technologists or scrub technologists. So now their job is to pass on all those instruments over to the surgeon. They also keep account of those instruments. So let's say there are 20 different kinds of instruments, cotton bags, towels that needs to be used during the surgery. So they'll keep account of all those equipments and instruments before the surgery. And once the surgery is performed, they ensure that all those instruments are kept back after they've been used on a patient. So it's not that a surgeon should not be careless while performing the surgery. So all the instruments that are used on the patient, they should be removed and kept back where they came from.
Okay. So I'm not sure how any of you have been into a surgery room. Just can you just turn off the screen sharing?
Yes.
I can see everybody. Yeah. Okay. So I'm not sure how many of you have been into a surgery room. Anybody? Anybody from this room been into?
Yes, actually, I have a
I've
very
seen in some
confident
web
girl, yeah.
series, but
Right. Okay. I have been to a surgery room a couple of times. Okay. So
Okay.
okay. So in a surgery room, when you enter that room, before you go into the surgery, there is a nurse who, or somebody who's sitting outside that surgery room. They will prepare you for the surgery. Okay. So what Jyotsna was trying to say here, they will prepare you for the surgery. They will ask you not to eat. It depends on what kind of surgery they are doing. They will not ask you to eat for a certain time. Before the surgery, they will take your blood, they will take your urine, and they will make sure your TLC levels are maintained, TLC infection levels are maintained, and you are ready for the surgery. Your body is ready to go under a surgery. Okay. So they will prepare you for the surgery. When they take you inside the surgery room, there is a bed, and there are so many, lights on top of that bed, when you're lying on that bed. And that is the most, horrifying part, that what is going to happen with you, And so there's a person sitting, standing next to you on the, left hand side. There's a person standing on your left and right hand side. There is a person sitting at your leg, standing on your head. There are several people inside that, surgery room. So it's not that just the doctor is involved into the surgery. Okay. So yes, the physicians, the doctors, they do the surgery, but to support that surgery, there are several other people in that operating room, right? So the equipments that are going to be used to operate you, they needs to be properly sanitized, sterilized. Okay, so to sterilize those equipments, there is a special person that is known as sterile processing tech, and it has its own special skills, and that person is certified to sterile that those equipments, the surgical equipments. And the doctor will start opening you apart when doing that surgery. So say for instance that it's an open heart surgery. Okay, that doctor is going to tear apart your chest in two parts. Okay,
They'll make an incision.
yeah, right. So the inside of your body can be seen easily. Then the doctor performs the surgery, and that doctor will walk out of that surgery room, left open your chest the way it was. Right now, that person cannot just get down from the bed and with an open chest and walk in the hospital, right? So that wound needs to be stitched properly, right? Because the surgery that was performed, so person who stitches that wound is known as the surgical technologist.
That person would be surgical first assist. Yeah.
First assist. Okay.
Yes.
Somebody
and they're certified to do that.
They are certified to do that.
Yeah.
Right?
And their job is also to hold on to the adjoining organs so that they can make space for the surgeon to operate on the right organ. And then if there's any bleeding, so this person would also help in pumping out that blood and making sure that that space is easy for the surgeon to operate. I mean, whatever procedures they're supposed to be doing. So they act more like a right arm to the surgeon.
So stitching that wound and making it look like an original, like it was never opened. So there are several people in that room that are certified to do that. So not everybody in the hospital is a doctor, right? There are several people other than the doctor who supports them to do the surgery, and there is a nurse also standing inside that room who's known as the OR nurse.
Yes.
The operating room nurse. That operating room nurse will have experience working in the OR. Understand? That nurse cannot work in a NICU. That nurse cannot work in an ICU. Right? So after the surgery is done, surgery cannot be done just like you go there and your eyes are open and you are looking at your organs coming out of your body. You cannot do that, right? So to do that, there is an anesthetist.
Yes.
And anesthesia is given to you, right? And that anesthetist is the highest paid person in the hospital. Okay? Because making somebody unconscious and bringing them back from that unconsciousness is a skill, is a that person is certified to do that.
They're trained to do that.
They are certified, right? There is a training given to them. Yes, please.
Sir, it is like anesthesia is an injection.
Yes, anesthesia is an injection.
And there is one more injection, morphine.
Morphine is for
painkiller.
That is usually given to the people in army.
Okay.
When they go on the war, they get the morphine injection, they get hurt. So, it's a painkiller. Morphine is a painkiller.
So yeah, if somebody has extensive pain, in that case, they are usually given morphine, but it is given only when the doctor prescribes it.
Okay.
Yeah. So basically it is, used in the army. When they go on the war, they get hit by a bullet or they get, severely injured. Before they bring into the surgery, it's a lot of pain they have to go through. So they give the morphine directly. In the Hollywood movies, you see that injection, they come and there's a prick it on their neck, jack. That is what they do. They give morphine. Okay.
Okay.
Yeah, all right. So, all these people that we just discussed, we hire all of them, right? We get, requirement for all of them, right? So understand how specialized skills these are, and how, what sort of people that you're going to be working with, what kind of candidates you are going to be hiring, right? Now, once that surgery is done, that patient is brought out of the surgery room. Okay. And then directly from there, that person cannot be sent home. Okay, you are done, boss, go back home. Right? So that person has to be kept in an observation room until the effect of that anesthesia comes down. Okay. So that room, just know what that room is called?
Yeah. That room is known as post anesthesia care unit, or it's also known as recovery unit, or they also call it post operative unit.
So
It's
called
in short,
PACU.
yeah.
Ma'am, and you told that one step down, so it also come in that?
No,
Because
step down is a different unit. So
Step down is from the ICU to
step down.
yeah, it's not an operating room, right?
right. So remember we spoke about 3 different stages under perioperative. So preoperative was before the surgery, intraoperative was during the surgery, and post-operative is the unit that we are talking about.
So that is what I'm talking about. The
Post-operative, or it is also known as post-anesthesia care unit.
Now, do not get confused in between PQ and PACU. Okay, PQ is Pediatric Incentive Care Unit, and PACU is Post Anesthesia Care Unit. Now, remember, the nurse who was there standing in the OR, helping the surgeon during the surgery, cannot work in the PACU, right? Because PACU has its own specialized skills, right? PACU
Can you
is,
repeat it?
yes, okay. Somebody who's a nurse, suppose I am the nurse, I have experience working only in the OR, operating room, right? I am not eligible to work in the post anesthesia care unit after the surgery, where that patient is kept under observation until that effect of anesthesia settles down and that person comes into its full consciousness, and then the care that is given to that patient is called PACU, post anesthesia care unit.
And one more thing, these nurses that work in the operating room, they're also known as the circulatory nurses or scrub nurses. So those are just the synonyms for OR nurses. Circulatory or scrub nurses.
What are these nurses? Who are they called?
Let me just write it on my screen so you can just make a note of it. Yeah. Circulatory nurses, or they can also be called as scrub nurse.
The nurse who works in an operating room.
Yeah, or OR nurse, one and the same thing.
So the 3 stages are the perioperative, before the surgery, where they prepare you for the surgery, the intraoperative, so during the surgery, and then post-operative, that is after the surgery. Any questions, any doubt in that? All clear to everybody? Yeah. Okay. All right.
Yeah.
All right. Okay. Just now, please continue.
Okay. So the next term that you may see while you're recruiting, it's known as MICU. So MICU would stand for mobile intensive.
Sometimes when you train, everybody has that weird imagination. So I always, try to, imagine a mouse under all of this, MICU, PQ, NICU, these are the names of those mouses living in that one hole.
Maybe little Jerry's.
Yeah, Jerry's, Tom and Jerry. So, MICU, NICU, PQ is kind of those, name of those mouses.
Right.
Sorry, I'm just, about my weird
Right.
imagination.
A little fun won't harm. Yeah. So yes, MICU or ambulatory care, they're one and the same thing, or the ambulances that we see. So do not get confused in between ambulatory surgical centers and ambulatory care. Both of these are different. Ambulatory care is the ambulance that you see. So these ambulances, they are equipped enough in a way that any sort of a patient, be it critically ill or not so critically ill, if they need to be transferred to a different facility or a different hospital, so these ambulances or these MICUs, they can help the patients to move into a different facility. In India, if we need to call ambulance, so the generic number that we have here is 102, right?
108.
108.
It is. Correct, yeah, 108.
Maybe 108. If we need to call police, then it's 100.
100.
Right. But in US, there is a number almost for any sort of an emergency situation. That number is 911. Okay. So anybody who requires any sort of help, they can dial 911 and they have the immediate assistance. Now, somebody requires a medical assistance. Let's say somebody met with an accident and they are in the middle of nowhere. If they need help, they'll probably dial 911 and somebody from the hospital will send these ambulances, which are known as MICUs or ambulatory care. So these ambulances, as I said, they may have ventilators, they have different machines, so they can keep these patients alive till the time they are moved to the hospital or to the emergency department. Along with it, there are professionals who would be coming along within this MICU. It could be a physician, there could be EMTs, there could be nurses. So EMTs we would say paramedics. So they are the ones who would be reaching the place where patient needs help or immediate assistance. So they may provide the basic care, they may provide a basic level of, or I would say the first aid, and then they move or they transfer those patients to the nearby hospitals. So it's their job to transfer those patients. Now, let's say there's a smaller hospital where they do not have the resources to treat the patient at an advanced level. And if the person needs to be transferred to a bigger facility, or let's say at the tertiary or the quaternary care, in that situation, the patient may be kept in a MICU and then transferred into a bigger facility. So usually patients who are not able to walk on their own, patients who are not able to move around on their own without the machines, they are the ones, if they require any transfers, so MICU is the place, or it's the transportation facility that can be availed. Yes, Anand, you want to say something?
Yeah, just wanted to add a couple of things on this MICU services, which different states, different counties, and different communities provide throughout the United States. One is, of course, the transportation service, right? Transporting the patient from their dialed in location, then providing it to the nearest point, right? So they are all connected. There are multiple, mobile units throughout the county, and they are all connected through an IT system. And whenever there is a dial in 911 goes in, since I worked on this project with multiple, so I'm just explaining that a little bit in deeper, that whenever there is a 911 call goes to the central, there is a 3-minute time, right? Within the 3 minute, there should be mobile intensive care unit or an ambulance should reach to the patient and treat them. That's a standard which they are trying to maintain, especially in the metro areas. In rural areas, it's a little bit more, but within 3 minutes, you should have that care. The second thing which I want to point out is they have very specialized, care service providers within this intensive care unit ambulances who carry the life-saving, equipments, life-saving drugs, life-saving, everything, and they try to treat on the spot itself. If it's a major accident, suppose it's happened in the interstate or highway, and someone need that care, they try to treat it right there on the spot itself. They block everything, they treat it, and they try to find during that period what is the nearest location for that. They don't just go to one hospital specifically or one clinic specifically. They can go the nearest possible unit or the department which have all the equipments to serve that patient based on that particular patient condition. And that's where the nurses comes into the picture, or care manager comes into the picture. So they are IT. It's it's combination of a team effort. So don't just think it is just one individual or two individuals taking care of everything. No, it's a team effort, and it is a very intensive care, unit. So very specialized professionals participate in that. So just a few cents adding it on your explanation.
Yeah, thank you so much. So yeah, I mean, those professionals, most of them, the kind of jobs that you will see on a day-to-day basis working in these MICUs, they are usually known as EMTs, emergency medical technicians, or they are also known as paramedics. So you'll see such jobs. So emergency department, I think we've covered. So I think we've covered most of the departments or units, I would say, that fall under the acute care setting. So I think that should be it for today.
Just now, what
I have
do you?
question. Oh.
Yes, please.
Yes, Trace.
For the ambulatory care, what is the specialism, sorry, that for the nurse or for the employers, what they need to have, a specialist in certificate? They need to be certificate?
Usually you will see jobs where they would need emergency medical technicians or the paramedics. So those are the ones that would need certain certifications. So yeah, they would have to be certified.
Okay.
Yes.
Okay, thank you.
Yeah, these certifications are coming up in our training.
So EMTs is usually, I mean, that's the title they usually have. So they are also certified, and they are trained in a way that they are able to do that job properly. Because the first aid or the first point of contact is going to be this person. So if they are able to react properly, if they are able to give them the immediate care, let's say if somebody is unconscious, somebody has had a heart stroke, or somebody is not able to breathe, so they should also be able to provide ACLS. They should be able to provide BLS. So they should be able to revive the patient till the time they are able to bring them to a nearby hospital. After that, it's the job of people working in emergency department to take it from there. Yeah. So
yeah, just now, what is it that we have in the menu tomorrow?
A few other categories, yeah, or I would say different facilities, but we should be able to cover them all tomorrow.
Okay, all right. Okay,
tomorrow?
Yeah, tomorrow at same time, 10:30
Same time.
EST.
I go.
Yeah. Now, I'm sure, after today's training, there are many, things that you must be thinking till today, some things that you are learning new now. Okay. So, moving forward, this is going to be your life. I mean, I'm not sure about people who are working with Vastec. You have certain other things, but my focus is completely on the healthcare and hospital hiring. Okay, so to guys, remember one thing: to hire these nurses, you have to think like them. You have to talk like them. You cannot be talking to them Java coding. You have to be talking to them, these healthcare terminologies, these language, so get used to it. Try, as I always say, self-learning is the best learning. I can train you, I can keep on speaking for another 1,000 days. Okay, but until unless you go yourself and start searching them by yourself on Google, try to do some analysis by yourself, that is when you would be able to learn things quickly. Okay, so yes, let's meet tomorrow at
10:30 EST.
10:30 EST again. Okay, but make sure, guys, please do not be late. Okay, we get late, we lose half an hour of our training.